I'm Jan Dennis, an advanced practice nurse at Cardiovascular Consultants. What is a heart attack? A heart attack, also called a myocardial infarction, occurs when there is a complete obstruction of blood flow through a coronary artery. The heart is a muscular organ that pumps oxygen-rich blood to the body. To function, the heart muscle must also receive oxygen-rich blood, which is supplied by the coronary arteries. The coronary arteries originate from the aorta and wrap around the surface of the heart. This extensive network of blood vessels supplies a system of delivery to the heart muscle so that it can carry out its pumping function. Coronary artery disease occurs when the inner lining of the artery develops plaque. Plaque size can increase quickly and a clot form on the unstable blockage. This causes complete obstruction of flow to that portion of the heart muscle supplied by the artery. If flow is not restored promptly, a portion of the heart muscle dies. Permanent damage can occur and the heart muscle will no longer be able to pump effectively. Urgent coronary angioplasty to restore flow is the treatment for a heart attack. How is a heart attack diagnosed? The patient's symptoms and a physical examination are an important part of the diagnosis of heart attack. The time of onset of the symptoms prior to presenting to the emergency department and the description of the discomfort, including the location, quality, and severity, are very important when determining how to treat the heart attack. Blood tests are performed to measure the cardiac enzymes. If they are elevated, then this indicates injury to the heart muscle. An electrocardiogram will be performed and is the cornerstone for the decision regarding the urgent pathway to treatment of the heart attack. If the artery is 100% occluded, the electrocardiogram will demonstrate ST elevation. When these three criteria are met, a code STEMI, or ST elevation myocardial infarction, is activated. An emergency team responds 24 hours a day, 7 days a week to urgently open the 100% occluded artery. The team is led by a specially trained board-certified interventional cardiologist, a STEMI registered nurse, and cath lab team with a goal to open the artery as quickly as possible. Once the diagnosis of heart attack is made, the treatment plan will be initiated very quickly. Remember, there is a window of opportunity to open the culprit artery and save muscle, and every minute counts. In the emergency department, the patient usually receives oral antiplatelet medications. This is given by mouth and includes aspirin and Plavix in loading doses. This combination of medication binds the receptor sites on platelets and prevents them from sticking together and forming a blood clot. Intravenous heparin. This is given through an IV. Heparin inhibits reactions that lead to clotting of blood and the formation of blood clots. Intravenous narcotics. These medications relieve pain and also reduce the heart muscle oxygen demand. If your loved one presented to an outlying emergency department and is transported to St. Luke's by air or land ambulance, upon arrival they will be taken directly to the cardiac cath lab. The code STEMI registered nurse is dedicated to moving you through the process as quickly as possible and will stay at your loved one's side from the minute he arrives until the procedure is complete. During the procedure, you will wait in a special family waiting room outside the cath lab. Following the procedure, the interventional cardiologist will come to talk to you about the results of the emergency coronary angioplasty.